Let me just ask Senator Kyl about the most controversial part of this, and that is the so-called public option, which would be a government insurance program like Medicare for younger people. Why are you so opposed to that, Senator?
Well, there are several reasons. Incidentally, I was going to quote from the Congressional Budget Office letter that points out that the expenditures here are going to increase, not decrease. So it's not as if we're actually cutting the costs of these government programs like Medicare. But in any event, the government-run program is objectionable for two primary reasons. First of all, a lot of people will acknowledge, even members of Congress, that it is the first in a two-step process to get to a single-payer system. And there are people on the left in this country who support that. Most people do not, and this is seen as the way to get there. And how do you get there? As Senator Schumer just mentioned, you've got a lot of people that have policies today with their employer, and according to the Lewin and Associates study, 88 million of those people will drop the coverage with the employer or be dropped because the employer can't. It'll be cheaper for him to dump them into the government-run program, put it that way. 88 million people. And that then brings up the second point. If you like your insurance, you get to keep it? No, not true. Yes. If you have your insurance with your employer and he says it's cheaper for me to send you to the government plan than it is for me to continue to provide it, you don't get to keep your policy anymore. Now you're in the government-run system. So that's the other objectionable feature, in addition to which there are a lot of costs associated with it and dictates from the federal government as to what is covered and what is not.
Let me answer that. First, the Lewin study, which John cites, is widely discredited for one good reason. They're fully funded by United Health, a health insurer.
It doesn't mean they're wrong.
In this case, they're very wrong. CBO says our plan, a more modest public option, there would be 4 to 6 million people, and they're not funded by anybody. They're impartial, and we both go by their readings. Here's the reason we need a public option, and we do. We very much do. The insurance industry is about the most highly concentrated industry in the country. In many states, 81% of the insurance is by one company. In 40 states, 2 companies dominate. When there is no competition or very little competition, every economist, left, right, and center, will tell you the costs go way up. And that's what's happened here. So you need to inject some competition into the insurance industry. The best way to do that is a public option. And the program that we've put together is set up by the government, but then it's on its own. There is no intent for it to compete unfairly against private insurance. Some of the original plans were. The House plan at the beginning, I would admit it was. But I came up with the idea, and the HELP Committee adopted it as well, of a level playing field public option. It gets an infusion of dollars from the federal government at first. It has to pay it back like it is a loan over a period of time. Then it has to meet the same rules, requirements, regulations, reserves as any private insurer. Now, I believe a public option will work better. Why?
Well, let me ask you this. Can you get enough Democrats, can you get 60 votes to vote for a public option? Because right now, independent Democrat Joe Lieberman says, look, no health care reform is better than health care reform with a public option in it. Senator Lincoln has a real problem with that. Senator Landrieu already has said she has a problem. Ben Nelson says he has a problem. I'm just talking about Democrats. Is it possible to find some way to get those Democrats to vote for them?
I believe we can, and here's why. 2 reasons. First, as I said, this is a modest public option. Many of those folks, when I spoke to them over the course of the last several months, their great fear was John's fear, that this would transmogrify into a government plan and would knock out everybody else. And by the way, the people from private insurance, in reference to what John said, are not even allowed to go into the exchange where the public option is. So they can't. And so the bottom line is, though, it is a level playing field. And then what we will say to the people from the more red conservative states, your state doesn't have to take it. But don't make it so that my state, which would like a public option, can't take it. And the opt-out works. And I think at the end of the day, everyone's going to be together. And I think the proposal that Leader Reid wisely put into his bill, which is a modest proposal, sort of in the middle of public option land. There are some on the left who don't like it. They want it to be more liberal, some on the right. Will at the end of the day be where we end up.
All right.
If you want it today, you can do it today. Maine has a public option. Massachusetts has the ultimate public option. Massachusetts has the second highest premiums in the country. Turns out public option doesn't drive premiums down. Maine is having a problem, as Senator Susan Collins, the former insurance commissioner from Maine, has pointed out. If a state wants to go that route, they can do it today, but it's not advisable. And, you know, to think that you can be both a competitor and the umpire and you're not going to have the advantage.
They're not the umpire.
Well, the government is the umpire.
No.
Chuck, please don't interrupt me here. I've read good portions of this bill. The government makes decisions, and I think there are over 3,000 times where in the legislation it says shall. The Secretary of Health and Human Services has tremendous power under this legislation. And as a result, a lot of people fear that when the government is both the competitor and the umpire, obviously they win. Final point on the public option. There are a lot of states where there aren't enough people, either in terms of a risk pool or in terms of the network of physicians and hospitals, to put together a lot of different competing plans.
Is this plan...
You don't help that by adding one more plan.
Are people going to have pay more taxes because of this?
Yes.
No.
Yes, no.
Right. Let me say this first on the public option. First, yeah, someone makes the rules, but under our plan, unlike what was feared before, the same rules apply to private insurance and to the public option. In other words, we say to private insurance, you have to have reserves in case you go bankrupt, so your policy holders are still there. Same with the public option. We say that you cannot cut people off when they pay too much, when their insurance, when their health care bills go up too much. Same at the other. So it's a level playing field public option, and it is not, one does not have an advantage over the other. It just creates good old-fashioned American competition.
Let me just ask you this, Senator. I mean, obviously, the wealthier people are going to pay more taxes,
yes.
But aren't people down the line going to have to pay more taxes as well?
No,
isn't this going to cost them more?
What we have focused on, particularly in the Finance Committee bill and then in the bill that Leader Reid put together, which I think has the best of the health bill and the finance bill, and that's why I believe it's going to pass the Senate with 60 votes, maybe 61, 62, who knows. And the reason is we focus mainly on cutting the waste, inefficiency, duplication, the runaway costs. Yeah, are there a few taxes on Botox and things like that? Yes. A small increase in the Medicare rate, but only for people above $250,000. The average citizen, no tax.
I'll give you 30 seconds to respond.
If you have insurance, you get taxed. If you don't have insurance, you get taxed. If you need a life-saving medical device like a stent or a diabetic pump, you get taxed. Pharmaceutical. The Congressional Budget Office says, and the Joint Tax Committee says, that these taxes imposed on others will be passed through. And why does the letter from the CBO say it's going to cost between $5 and $10 billion for the IRS? Because the IRS has to enforce these tax provisions.
All right. We have to end it there. Thank you all both for a very enlightening discussion.